Good morning, I'm Amy Burrow. I'm the manager of the volunteers here at St. Dominic's Hospital. Morning to you.
Morning, Tu Fan, I'm the Chief Operating Officer here at St. Dominic's.
Tufan, we are both breast cancer survivors, and I'd love to know, how did you find out that you have breast cancer?
Well, it was about 5 years ago. I remembered like it was yesterday. I was in the shower, did myself breast exam, and felt something in my breast. Took me a few weeks to get to my GYN because I have a history of cysts, and I thought maybe it's just another cyst. But I finally went, and we went through the mammogram, ultrasound, and did a biopsy. Turns out that it was breast cancer. So found out in late July, and 2 weeks later was already undergoing treatment for it. So how about yourself?
I have a similar story. I had attended my yearly annual exam with my GYN and had a clear report. And 3 weeks later, I had swelling in my left breast. And having just been to the doctor, I was hesitant to go back, thinking it was probably nothing. But something really urged me to go get that checked out. And when I did, it ended up being a pretty aggressive cancer that I had after ultrasound. I was diagnosed with a inflammatory breast cancer. The reason my mammogram was negative is inflammatory breast cancer. The cancer cells actually block the lymph vessels in the skin of the breast, and that's why I had some swelling. So in the inflammatory breast cancer world, I was diagnosed very early, but it had already advanced to stage 4. So it's a rare breast cancer, but it's very aggressive. And we started treatment immediately, and with chemotherapy, I did have a mastectomy and 6 weeks of radiation, and I was able to have a clear PET scan after that. And so, again, we caught it very early, but I was thankful that I did not hesitate to go back in, even though I'd had a clear test to, see what was going on, have that further tested.
So I was told that my form of breast cancer, mucinous carcinoma, is also rare. About 2% of women have this form, but it's also the least aggressive. And so I was really lucky. But because of my age, I decided to take a more aggressive approach and also had a mastectomy, just as you. And so I'm glad I did it, and it's been 5 years since then.
And you're still on a treatment plan, or?
I am.
Yes.
I am. I take a pill every day, probably for the next couple of years, and we'll see what happens. How about you?
I am still receiving, I am still on a treatment plan. I receive an infusion, but the medication is working. My scans are still clear. So I'm very thankful for that. And I found that at St. Dominic's, I've been able to work my work life and vacation life, time off life around my treatment plan, and that has given me a lot of reassurance that I can continue to do the things that I want to do. And work has been very helpful to be able to continue those things and kind of take my focus off of myself and be able to focus on the things that are important to me.
I look back and from a patient perspective, when you get that diagnosis, everything happens so fast. And there's so much information that's coming at you, and you feel like you have to make a decision fairly quickly. And so, it was all a whirlwind back 5 years ago. So, had a lot of support for both family and work, and really, happy to be here and be 5 years out this year.
And I've experienced the same thing. I'm 6 years out, so we're in the same place there. And that family support, my support. I worked here at St. Dominic's during that time, and my coworkers, the volunteers. I had so many people praying for me that it was important for me to be a part of owning that ownership of my care and wanting to be a part of the solution And that encouragement from my family, friends, and was such a big part of it, and still is today. I find that if I get stressed or maybe lack of sleep, those anxieties can come back pretty quickly. So continuing to have that support is so important, and finding ways to cope. I find if I can just get outside some days, even at work, that just adds so much to my balance of staying well and also still being in a treatment plan that I know, I will be on for a very long time. But with my support team, it's been very doable, and thankful for that.
Now, Aimee, did you have a family history?
I do not have a family history, and I had genetic testing done, which was all negative, meaning I don't have the gene for breast cancer, and so it was very. I look back on my early diagnosis and so thankful that I did not let that linger, and especially since it was so aggressive from the time I saw my doctor 3 weeks later. It was moving very quickly. So I did not have a history, and those yearly exams are just so important. And as you said, self-exams also. And just when something doesn't feel right, doesn't seem right, getting that checked out. And so, did you have, you said you didn't have
No family history, and actually for Asian women, it's quite rare to develop breast cancer, so I had no family history. My gene testing was also negative. And so, my two daughters here within our family are now more aware and alert of it. And of course now, when they go to the doctors, they do have a family history of breast cancer. And so there's more attention paid, when they're doing their breast self-exams and, kind of being proactive in terms of, looking out for those signs and symptoms.
Well, and I do have two sons. I don't have daughters, but also that family history. I know for men it's important that they are aware of that. With when they are having their annual, which I really encourage them to get a PCP and have their annual wellness checks and make sure that history is, discussed with their doctors.
How's your perspective changed in terms of life and work and all that good stuff?
That's a great question. I do find that I don't really let myself get too stressed over things that used to probably stress me out more. I feel more grateful and thankful for the things that I have and where I am, and that I have had these 6 years. I've had some great 6 years. I've watched my children finish high school, finish college. One is married now, and so I realized how much my healthcare team did for me to help me get to a place where I could enjoy those things. And I'm just super grateful on a daily basis. How about you? How have you experienced that?
I'm very grateful as well. It was something that, was unexpected. So I'm really grateful to be here. I have, like you said, different perspective on, what's important and what's not important. And then I also have a sense of perspective when it comes to kind of major life decisions. I've always been a non-risk taker historically, and so now I have to think about, how much risk can I take? Do I go for it? Do I not go for it? And that kind of diagnosis provides me with perspective in terms of, going through things that you might not have done before, and seeing and just giving it a chance and taking a risk, because you just never know what the next day brings you.
that's great. And we're so glad at St. Dominic's that you joined us here and you did take that risk, moving across country to be with us here at St. Dominic's. And I'm so happy to have spent this time sharing our stories with each other. And I know that's not always the easiest thing to do. So it's nice to be able to discuss those things and maybe help other women who find themselves in similar situations.
And since I've been here, I've transitioned my care to St. Dom's, and I feel like I'm in a pretty good place because I have a lot of support here at St. Dom's from coworkers as well as from the providers that are providing that support. So I feel really good about the future moving forward. We have a great team here at St. Dom's who understands and they're really passionate about taking care of patients such as ourselves.
And I agree with that, having my healthcare team here at St. Dominic. From the minute I was diagnosed, they took me in their hands, and I didn't really, they helped me make the very tough decisions, very quick decisions, and are still following me. And I appreciate the fact that they've never stopped following me. So they are there, and getting to see them in the hallway every day is great too. It feels like part of my family, and I do feel like the coordinated care from all the different parts of our cancer services with radiation, surgery, our infusion center, nurses, everyone. There's so many parts and pieces that work so well together here that I experienced, and at a time when it's very, very frightened and very unsure, they certainly took care of all my coordination of my healthcare plans.
And I know we've talked about, the purpose of us talking about it today, and we both agree that if we share our stories and made an impact on just one person, physically go and get their mammogram or do their breast exam, then it's all worth it.
It's all worth it.